as you mentioned, I am with National Institute of Nursing Research, which is part of NIH. Nursing research works to improve patient care at the bedside, in the clinic, and in the community. Nursing research can improve people's quality of life, whatever their age of stage of illness, and palliative care is a good example of that. So that's what I'm going to talk about today, is some of the resources that NINR has developed for palliative care. So a lot of people, most people maybe have never heard the term palliative care, or if they have, they might associate it only with end-of-life care. And there are a lot of misconceptions about palliative care that I just wanted to address first. One is that it's only for patients at the end of life, and that's not the case. Palliative care can be incorporated into a person's treatment plan alongside of other treatments that they might be receiving or other types of care. And that patients and families can receive palliative care not only at the end of their life, but throughout the course of an illness. So a lot of people think it's the same as hospice care. And while hospice does include palliative care, it's focused on a person's final months of life, whereas palliative care is for chronic illnesses and serious diseases that can last many, many years. The other misconception is that it means giving up hope. So some people think that discussing palliative care with their family or with their healthcare provider means that they are giving up hope on either a cure or an improvement in their condition. And that's not the case, because palliative care can improve a person's quality of life. It does not mean you're giving up hope. It means you're offering a different strategy for managing symptoms. And that the other misconception is that families will become fearful. So a lot of people are very hesitant to bring up the subject of palliative care if you're a provider, or families are hesitant to hear about it because they do have these misconceptions and these associations only with end of life. But once the topic is brought up, a lot of families are actually very receptive to palliative care and incorporating it into the treatment for either themselves or their child, if their child is ill. So what is palliative care? Some people may ask what it is, and NINR developed a brief video to explain pediatric palliative care, but most of the same principles apply whether it's pediatric or adult. So I thought it might be good to just show this video to give an overview of palliative care and what it is, and we can start with that.
2 seconds.
Pediatric palliative care is a unique type of care that addresses the symptoms and stresses of serious illness while focusing on quality of life for children and their families. It's available at any age of childhood, ranging from newborns to young adults, and at any stage of an illness. A child's illness affects the entire family, so palliative care supports parents, siblings, grandparents, and other family members, as well as the patients. The added layer of care it provides can reduce stress during a difficult time and provide comfort in a variety of ways. Palliative care providers can ease pain, offer emotional support, address family concerns, communicate with other providers, explain terms and care options, coordinate care and appointments, and locate important resources for the whole family. Palliative care is different from hospice care because it's available at any time during a serious illness and regardless of prognosis. In fact, care can begin as soon as a family learns about the illness, and care can be provided at the same time as other treatments, working alongside a child's primary medical care team. Healthcare providers will often refer patients to palliative services, but families can request them as well. Every palliative care team is different and may include doctors, nurses, child life specialists, respite providers, art and music therapists, chaplains, counselors, nutritionists, and pharmacists. And care can be provided wherever the patient needs it, in a hospital, a clinic, or at home. The palliative care team can even help facilitate smooth transitions between settings. Care is customized to meet the needs of each patient and family and offers support based on their beliefs, culture, and preferences. Parents say that palliative care benefits families because it provides the comfort and support they need while focusing on quality of life. This emphasis on living life to the fullest is one of many things that makes palliative care so special. Talk to your loved ones and healthcare providers about the benefits of palliative care. Conversations matter. Start one today. For more information and free resources for families, providers, and organizations, visit the National Institute of Nursing Research, part of the National Institutes of Health, at ninr.nih.gov/conversationsmatter.
So that video was something that NIR created as part of our Palliative Care Conversations Matter campaign. It's a health communications campaign that focuses on pediatric palliative care and developing resources that providers can use and also families can access. We also have resources for adult populations as well. So I'm just going to go through kind of what's available. I did bring samples of almost all of our materials. They're on the table outside. You're welcome to take copies with you. These are also things that if you want to use them in your practice or you want to use them for your organization and give them out to people, you can order them free of charge, or you can download them from our website as well. So I'll just go over some of what we developed and kind of how we developed them. This is the campaign that I mentioned. So some of the things that this campaign encourages, but that NINR encourages in general, is that we conducted extensive formative research. We talked to a lot of parents, we talked to providers, we talked to healthcare professionals, and a lot of researchers. So everything we do is evidence-based. We're part of NIH. We want to base this in, the studies that are out there, but then also talk to the people who are using our materials or who could be using our materials, and make sure that it's something that they want, they need, that it's something that fills a gap. So the campaign encourages that palliative care be recommended early on in the course of an illness, and along with other types of care, that it's something that's continued as a dialogue throughout someone's illness, that patients and families understand palliative care, and it encourages a conversation between healthcare providers and patients and their families. The other piece of palliative care is kind of listening to the unique needs of patients, because obviously everybody's different, every illness is different, and what works for one might not work for another. The other piece is access to palliative care. So some places don't have formal palliative care teams in place, but there are components of palliative care that could be incorporated into a treatment plan that could be beneficial for a patient. And then to provide easy to understand information that really resonates with the people that could potentially use it. So this shows just a screenshot of our campaign webpage on pediatric palliative care. There's different sections. For families and patients, those are information that directly relates to families. It's written in a way that can be used by anybody. There are brochures, fact sheets, resource cards, videos. The healthcare provider section, very short videos, because healthcare providers told us they don't have a lot of time. So we did a couple minute, just kind of like what I showed. We have that was our animated one. The other one that a lot of providers really like is it's a mother talking about her family's experience with palliative care, because families told us they want to hear from others who have used palliative care and what their experience was like. And some providers have told us that they actually show that to their patients, or they'll show it to like new staff coming in or at grand rounds or something to share the idea of palliative care with others. The provider perspectives box, that goes through very brief interviews that shows the interdisciplinary nature of a palliative care team. So it interviews kind of members of a team and who's on the team and what they do and what their role is. The outreach and media, those are things that can be used by organizations. So there's web banners and badges, drop-in articles. There's a social media calendar and social media content that anybody is free to use if they'd like to. So those are the resources that we have available. And if you go to the next page, this is when you go to the campaign materials page. You'll see at the top we just last week launched a shopping cart. So we're a little bit more like Amazon now, where you don't have to send us an email or call us, which you're welcome to do, but you can actually order materials through a shopping cart, and you can put in how many you need. Everything that we do is available in English and Spanish, so that these are all things we tested with parents and also with providers. And I'll go through an example of one of the interesting things that we learned when we were testing one of our materials in Spanish. And so the different categories are things that we went over. There's a Spanish language button on this page that can access all the Spanish language materials. There's also a Spanish button at the top of our campaign page that has all the information in Spanish as well. That was one of the gaps we really identified, is that there weren't many materials in other languages about palliative care, and it's a tough subject to actually translate and have it resonate in a positive way. So for providers, the main piece we have for providers is a tear-off pad. And this shows the front of the tear-off pad. I have examples out in the hallway. We recently redesigned it so it's a spiral-bound tear-off pad that providers can use. The purpose of it is to guide a conversation with a family about palliative care. And the front of it is just an explanation of kind of how to use it, and then some Q&As that patients and families might have, some suggestive responses. So this shows the front, how to use it. Again, available in English and Spanish. The interior pages are for the patients. So this is something that they're customizable, so it doesn't matter what the illness is or diagnosis, it doesn't matter what the prognosis is. These can be customized based on the conversation that a provider is having with that patient or family, to say these are parts of palliative care that might really benefit this patient. And here's what we recommend. Here's some members of the team that we would recommend. Here's some suggestions about when we can talk about this again. So it's not a one-time conversation. The other thing is, parents told us, understandably, they are completely overwhelmed when they have discussions with nurses and doctors and other healthcare professionals, that they don't retain any of the information that they talked about. And so the nice thing about this is you can tear it off, give it to the patient. A lot of providers told us that when they use this, they make a copy of it and stick it in the patient file so that they have a record of the conversation discussion as well. Sorry this keeps making that sound. I don't know what I should do about it. I'm trying to stay away to see if that would help. Okay.
Just turn it off so it doesn't do it anymore.
So the materials for patients and families, there's a brochure, there's a family perspectives book, which profiles a couple different families, a fact sheet, a resource card, frequently asked questions on our website, and then a couple videos as well. So if you go, I'll go through each one briefly. This is the brochure. The brochure goes through common questions that families might have and some responses to those. General information about pediatric palliative care. One thing that I'll mention about this, and there are copies out there if you want to take them with you, is when people are using these in hospitals and clinics, a lot of people have told us that they've made like a sticker or a label that they can put on the back with their local contact information so that a patient has that when they go home. So that this is general, but then you can customize it a bit for your own practice. The Finding Family Support card, this is double-sided. This gives some general ideas because families told us they don't know where to start in these illnesses. These are suggestions for types of support that might be available in their community. It's fairly general because we had to develop something that can be used nationwide across the country. But the interesting thing of this is when we translated this into Spanish, we tested it with Spanish-speaking parents. And this just shows kind of the health communications piece and why it's important to ask the audience that you're actually doing these things for. So we showed it to them, and the parents said, the translation was fine, the information was good, but they did not like these icons, okay, at all. And they actually thought they were a turnoff. And they wanted to see pictures of real people and families. So the Spanish version of this card looks different because we had to redesign it to include real pictures, but it's the same content. So if you see it out there, same information, just different formats. So I thought that was interesting, and it shows like why we actually talk to people about what we're doing and ask them. We don't want to turn anyone off, so that was fascinating. So this family perspectives, this is again coming out of parents telling us they want to hear about others. And so we asked people to send us their stories of their experiences with palliative care. This profiles 4 different families. The nice thing about it is it's a range of ages. So it's newborn up to, I think the one person is 19, and he's been receiving palliative care for 7 years at the time that this was written. So it kind of gives a good overview. People that are maybe reluctant to talk about palliative care can see what maybe it's done for somebody else, and then they're a little bit more open to it. This brochure is our adult brochure. It's available in English and Spanish. Again, it's kind of a really nice summary and overview of palliative care and what it does. This is for any type of disease. It's written in a very general way. A lot of palliative care information is focused on cancer. Ours is specifically not focused on any one disease. And there are copies of this out there as well. So a couple things if you're wondering what you can do, depending on your role. If you're a patient, a family member, a provider, is to identify the need for palliative care if you see one. Sharing information about palliative care and the information from the pediatric campaign, starting discussions, and learning about services in your community. You can access materials online, or like I said, you can order them if you'd like, and share them with others, especially bringing them back to your colleagues and team members. So I think we'll have questions later, but I wanted to mention one question that a lot of people ask me. How can they find palliative care services in their community, right? So we couldn't do that with our materials, but there is a place that does it, and they do a good job. So it's called, the website is getpalliativecare.org. And you can search by zip code, city, or state to find local palliative care programs in your area. It's a great website in general. We don't, because we're part of NIH, we don't have a lot of different websites on our materials, but they do a great job of having this provider directory that's very helpful. This is my information. You're welcome to contact me if you think of other things that you'd want to know about, or you have questions, or you'd like to hear more about how we developed the materials and kind of our next steps and what we're doing with all of this. But a big part of what we're doing is making sure that people are aware of what we did. So we spent a lot of time and effort developing these, and now we're at the point where we're trying to share them as widely as possible. So thanks very much for having me, and I guess we'll move on.